During this COVID-19 pandemic, scientists have been working to stop the spread of the infection. Meanwhile, here on the Verify team, we're working to curb the spread of misinformation. One question we've seen is this: if you've gotten the virus, are you now immune from getting it again? Maybe you've wondered whether they need a vaccine. So let's verify. Should you get the vaccine if you've already tested positive for COVID-19? Our sources are the Centers for Disease Control and Prevention and a pair of infectious disease experts.
Based on what we know right now, it's likely that a vaccine would be recommended for a person who's had COVID because we don't think that prior infection is likely to generate lasting immunity.
Dr. Stuart Ray, a professor of medicine at Johns Hopkins, says the vaccine will add a layer of protection.
Given the stakes, it seems a good idea to be really sure.
I think the answer is going to be yes.
And Dr. Linda Nabha says that if a patient does acquire some antibodies, we still don't know how long those antibodies last and whether they provide immunity.
I've had patients in my office who I have had documented cases of COVID, documented right through the nasal swabs, and have been positive for a few months. And I've tested their antibody tests, a few months later, and they're negative. Shocking. But it does happen.
On their website, the CDC says that, quote, people may be advised to get a COVID-19 vaccine even if they have been sick with COVID-19 before. So we can verify. If you're one of the millions of Americans who have already contracted the virus, our experts say it's probably going to be recommended that you get vaccinated. With your Verify, this is Evan Kozlov.